like.
Back on Around the Table on the original KHOZ, I'm Coleman Taylor, along with Spree Hilliard, and in our studios right now, special guest, Dr. Gary Linker, who's a psychiatrist with the Memory, Mood, and Thought Center at North Arkansas Regional Medical Center. Dr. Linker, it's good to have you in today. How are you?
Thank you. I'm doing well. Thank you very much.
Thank you for coming in and being with us. It is the month of June, and on our live stream and such, we have turned our logo purple for the first couple of weeks of June because it's Alzheimer's Awareness Month. And so we brought Dr. Linker in to talk a little bit more about Alzheimer's disease and what the Memory, Mood, and Thought Center at NARMC does. Dr. Linker, how long have you been working with patients dealing with things like Alzheimer's and various forms of dementia?
Would be 1996.
96.
96.
Wow. So you're at 25 years.
25 years. Yeah. I did some specialty training, 3 years on the East Coast, National Institutes of Mental Health, a little stint at Johns Hopkins. So
yeah, wow. So you've seen it from, I guess, all sides, pretty much, it sounds like.
Yes, in my fellowship, we were truly studying in whom this illness might hit, so it's called a longitudinal family study. We would take people that are now my age, in their 50s, that had a strong family history, and we'd take spinal fluid, do imaging tests, blood tests, and, of course, cognitive testing to see who's more susceptible.
Yeah. Well, with a disease like Alzheimer's, what I always hear is that we don't know really what we don't know, it seems like, with it. Is that still pretty much the case with Alzheimer's?
There's a phrase that I prefer, and it's called a final common pathway. So the final common pathway is I have a bump and it's itching on my arm. Well, if there's a whole streak of itchy bumps on my arm and I got into poison ivy, which I'm susceptible to, it's probably poison ivy. Otherwise, it's no-see-ums, chiggers, ticks. So that's the skin response, the final common pathway. In the brain, if you have certain damage to the brain, certainly vascular damage like a stroke, head injury damage, deficits of important nutrients, you're going to have damage, and that damage is going to come up in a form of memory loss, problems with word finding, problems with problem solving, orientation. So Alzheimer's disease is a type of brain damage, if you will, brain failure, if you will, caused by two proteins. They're the ones most commonly blamed for it, beta amyloid and tau protein. On chromosome 21 is beta amyloid, and on chromosome 17 is the tau protein. They're both important. You have to have those proteins to function. Something runs amok and goes wrong with the production and the processing and the clearance of those proteins, and you collect these abnormal proteins over time, which does cell damage, which then causes, in Alzheimer's, generally, typically, but not always, problems with new learning. And so new learning is what you and I are talking about, and audience is listening to, and what did they say? New learning is, I was supposed to be here at 11:15 today, and I had to find the place. So you start having troubles and struggles with remembering common things.
Right. So that's why a lot of Alzheimer's patients can often remember their childhood and things like that, but not necessarily know who you are today.
Yeah. Well said, absolutely.
Yeah.
What is it about, mental health and Alzheimer's and things like this that drew you to this field? Obviously, this is a very specialty work that you're doing. What was it that you said, this is what I want to dedicate my life to?
Probably, I would have to say grandparents who were afflicted with, and including my father, who were afflicted with some sort of dementia, and research. I just like the brain, and so it's, every mental illness is at some level a malfunction of whether it's a protein or some sort of chemical, neurochemical. It's a malfunction of that. So the research really interested me.
Yeah. What about with things like this new drug that's come out? We've read about that a little bit this week. That there's a new drug, the first in almost 20 years, that's supposed to actually be to treat Alzheimer's. And there's a lot of controversy around it. What are your thoughts about this new drug?
So the drugs previously, and many people listening are probably have taken these in the past or considering taking the drugs that are FDA approved. They're called cholinesterase inhibitors. So acetylcholine is the sticky on the mental fly paper, is what I always say. If you don't have enough sticky, the fly lands and works its way off. So new information goes in one ear and out the other, as they always say. So the acetylcholinesterase inhibitors, like donepezil, Aricept, was the first one FDA approved. They're thought to help improve the stickiness on your flypaper, but it does not cause the root problem of why your flypaper is not so sticky anymore. These new medications are in a different class altogether, but they're tackling one of the final common pathway that's doing damage, and that's the beta amyloid. There are others out there that may be more effective even than this aducanumab that was just, I guess, FDA approved on Monday. And so the monoclonal antibodies are new on the scene, relatively new on the scene for the last decade, and are starting to get traction. They are working to teach your immune system to identify something that's abnormal, like a beta amyloid plaque. On the other side of that, there's also monoclonal antibodies that are targeting the tau protein, the neurofibrillary tangle. And so you could imagine the best drug would do both simultaneously.
Right.
There's probably multiple pathways that lead to the production of beta amyloid and tau that cause those to be malformed and to cause damage.
What is the controversy behind this drug? What's the problem that a lot of people are having with it now that it's been released?
That one of the initial clinical trials failed to show any benefit. A second one showed some benefit. When they started teasing out the people that had finished, and it was fewer than 400 people, as I recall, that had finished the trial before it was stopped, they looked at the subset of those that took the highest dose and identified those as responders. And so that's not to say the drug doesn't work, but the FDA found, based on the fact that there's people out there that are so desperate to have, you and I would be too, to have a new medication that might actually slow down the disease. The current medications do nothing to slow down the disease, and they really don't help that many people.
Yeah. It seems kind of like that you could almost kind of compare this like to, well, COVID vaccines when it was on this emergency that, you know, had emergency authorization because we had to have something. This has been going on for a long, long, long time, but it's still kind of at that point of there's been really no significant progress made. So is this drug kind of the thing they're throwing out there because we got to have something?
Yes, and it also helps restore hope to the community of researchers. Drug companies are jumping ship. They don't want to invest hundreds of millions of dollars in, because they already have and it hasn't worked. So the community, research community, there's fatigue and despair actually in the research community because we haven't done anything meaningful yet. So I think this does promise to help some people, and two, it promises to bring more new therapies to infuse hope in the research, to get money to do the research.
You were telling me before we started talking today, actually, that you say in a few years that we'll not just have Alzheimer's, we'll have different kinds of Alzheimer's to be able to diagnose. Will drugs like this kind of help along that path?
I absolutely believe so. So right now we call everything that is problems with memory, thinking, processing, language, orientation, we call that a brain failure, a dementia. And then we say what kind of dementia. Dementia of the Alzheimer's type, beta amyloid plaques, neurofibrillary tangles are what's causing the disease, but something's upstream causing those plaques and tangles to emerge and do damage. Vascular dementia, dementia of chronic disease, hypertension, diabetes, high cholesterol, dementia due to deficits of nutrition, dementia due to trauma, head injuries, infections. So I believe Alzheimer's, we can look at cancer. Before BRCA1 and BRCA2, breast cancer genes, there was breast cancer. There was estrogen receptor positive, estrogen receptor negative, and that had meaning. And knowing those now helps people determine what's the best course of action, which medications to take or not to bother with.
Yeah.
And so I do believe that we'll be better at teasing out subtypes of Alzheimer's disease, not just plaques and tangles. That's where we are right now. But what's causing the plaques and tangles, then we can jump on the, go upstream a ways and try to do major changes with the pathology.
Now, if someone's listening today and they are going, okay, look, I'm having some memory loss, or I'm having some issues, or I have a family member that's having some issues, what do you recommend as their next steps? What do they do?
You need to talk to your primary care physician. There are many people are hoping they don't have it, just like I would hope I don't have it. But many times there's other causes. I've met so many people through the years that they either had undiagnosed sleep apnea, or they were diagnosed and they just couldn't and wouldn't work with that doggone breathing machine apparatus or whatever.
Right.
It's cumbersome. People with pain, people on medications for certain conditions. So you really need to go in and be direct. I think the thing that is being said right now, is it a senior moment or is it a time to talk to your doctor moment?
Yeah.
And if you're having problems, if you and I had a lump somewhere that was growing, we would be concerned.
Right.
And so we need to be more concerned about these. But there's lots of medical conditions. So looking at thyroid, looking at blood values, certainly blood sugar, blood pressure, and the medicines for those diseases is important.
Yeah. What is the kind of the history of Alzheimer's? How long has it been since we've had the name Alzheimer's disease to put behind this?
So one of my colleagues, a little older than me, Dr. Alois Alzheimer's, was studying, he's a psychiatrist, and was studying a lady who presented several years earlier. She died in 1906. Augusta Dieter is her name. And so in 1906, he did an autopsy and actually found microscopically with stains these beta amyloid plaques that are now called plaques, and these neurofibrillary tangles. He found things outside of the cells, the plaques, and inside of the cells, the tangles, and he saw the damage. And then one of his colleagues named it after him a few years later, about 1910. The interesting thing about her is she presented in her mid-50s.
Oh, wow.
I would say that there's a lot of that in the community, but that could have well been a Alzheimer's, a strong genetic influence. And there's many genetic patterns that can contribute to Alzheimer's disease. So there's the familial, otherwise called early onset Alzheimer's.
That's amazing to think. That's almost 120 years ago, 115 years ago anyway, and we're still, just kind of where we are, almost kind of treading water, trying to keep up somewhat, and not really able to.
Yes.
It's amazing, especially with the advances today. Yeah.
Absolutely.
And now tell us a little bit about the NRMC's Center for Memory, Mood, and Thought. That's where you are based out of. And I know that sometimes our community doesn't realize what it has in its own backyard. So tell us a little bit about what you guys do there.
Well, I came over from Fayetteville in 2016, 6 years ago, and joined the facility. The old language is geriatric psychiatry. And certainly we work with people who are older, 55 and older, who may have chronic, any kind of illness, schizophrenia. We end up with a lot of people with sequela, the aftermath of a fall and an injury, post-surgical type of situation, many of whom were already teetering on the edge of cognitive impairment, and they just didn't know it. We end up with people more confused after hip fractures. And it's not that the surgeries were botched, it's just that your brain, your ability to take that, as we all know, as we get older, it's harder to recover from anything. And it will come out in the form of confusion, hallucinations, anxiety.
Yeah. Wow. Well, there is a great number of resources available there, but for people that, like Spree said, are starting to wonder if maybe that's the direction they need to go, primary care physician is the first step.
Primary care, and if it's significant, you need to persevere and say, I would really like to go see a neurologist. In the end, what happens at the primary care physician, you can only spend so much time. So the mini mental status exam, the St. Louis University memory scale, these are 10-minute at the longest memory tests, and you'll pass those unless you're really doing poorly. You have advanced dementia if you're failing one of those. These new drugs that you were talking about earlier that's approved, and those that will be coming, they're going to be targeted towards people with the earliest pre-Alzheimer's, which is called mild cognitive impairment. So there's actually a preclinical phase that no one can even tell. You don't know you're having problems yet, and that can be going on for years, decades, much like the accumulation of cholesterol in an artery around your heart before you go down clutching your chest. With a heart attack, it's my poor diet and lack of exercise and habits maybe that's contributing, and family history. So it's going to be important to see a neuropsychologist at some point so that they can put you on a mental treadmill. Yeah.
Well, Dr. Linker, it's wonderful to have you in, and I appreciate you taking the time to talk about a very important issue. In June is Alzheimer's Awareness Month, so it's good to bring a little awareness, whatever we can, to that anyway. Thank you for being in today.
Thank you.
Dr. Linker with NARMC, the Mood, Memory, and Thought Center. It's Around the Table on the original KHOZ. We'll be right back.